And welcome once again to Say Yes to Life series. Say Yes to Life is an initiative introduced with the aim to offer hope to every person suffering from mental illness through awareness building and, of course, reducing the stigma of talking about mental health. This series will feature India's foremost psychiatrists sharing their perspective on the forces that shape the mental health narrative. And I'm very delighted here to welcome our featured speaker for the fourth and ultimate session of this series, Dr. Mohit Shah from Mumbai. Let me tell all of you that Dr. Shah, of course, needs no introduction. He is a consultant psychiatrist at the Advanced Multi-Speciality Hospital, Mumbai, and also a consultant for Medincell, France. He's been the winner of the Young Scholar Award of Psychiatry in 2009, and in 2018, he was invited to France to talk on mental health in India. His areas of interests include depression, anxiety, schizophrenia, bipolar mood disorder, relationship problems in adults and adolescents. Wow, this is pretty much covering the entire mental health gamut, Doctor. Doctor, of course, we've spoken about the various aspects of mental health or clinical depression and topics like that. I have a very, very interesting and very important question and an area that we need to throw light on, and the question would be resilience, building skills to endure hardship.
So resilience has become a buzzword. Everybody says that be resilient, be strong.
True.
But actually it is not so easy. And resilient is not a personality trait, it's a life skill. You learn to be resilient over a period of time. And there are basic components of resilience.
Right.
So a very simple mnemonic to understand resilience is FRAT, FRAT. So FRAT stands for fitness. In fitness, it includes physical and mental fitness.
Right.
Physical fitness, of course, you can exercise, you can do any sports activity to build up your physical fitness, yoga, meditation. Mental fitness is very, very important to become resilient. See, if you have a clinical anxiety or a clinical depression, you can't be resilient, you can't be strong. People will say snap out of it, don't think negative. Nobody wants to think negative.
Yeah, resilience is being mentally strong, but if there is a mental situation,
You can't become mentally strong. So being aware of your mental health, seeking help for your mental health conditions, like you are spreading awareness for the stigma associated with mental health, anxiety, depression. If you are anxious or you are depressed, you can't become resilient.
True.
So mental health is a very important component of resilience. The other important component of resilience is reaching out. So as I said, F standing for fitness, physical and mental, R standing for reaching out. Reaching out is accepting help. You should know your limitations. You should know where to draw the line, where to go out and take some help. Not only in terms of your mental health. Yes, if you have a mental health issue, you go to a professional and sort out your mental health problem. But even reaching out for some other problem, if you have a financial problem, you need to reach out and tell the truth before you are at a loss of 2 crores. If you don't tell, you may get a loss of 4 crores. So you need to reach out and say, boss, I have messed up. I have a loss of so much of money.
You know, it's easier said than done. So many of us, there's so much of things involved.
Yeah, what will people think?
True.
लोग क्या
You
कहेंगे?
end up reaching out so late.
Yes.
that कोई कहता है यार पहले आ जाता है यार,
पहले
अभी तो
आ
आया।
जाता है। अभी इतना बढ़ गया है प्रॉब्लम की सॉल्व करना बहुत मुश्किल है। अगर पहले ही आ जाता, so reaching out is also an important component of learning to being resilient.
True.
Third is awareness. Awareness is awareness about your own self. कि where I stand, what are my limitations as a person, on terms of finances, in terms of relationships, कि भाई मुझे कितने फ्रेंड्स रखने हैं, मुझे कितने दोस्त मैं हैंडल कर सकता हूँ, या कितने असाइनमेंट्स मैं हैंडल कर सकता हूँ, या एज अ डॉक्टर मैं कितने पेशेंट दिन में देख सकता हूँ. मेरी कैपेसिटी है 15 पेशेंट देखने की और मैं 25 पेशेंट देखूंगा तो आई विल मेक अ मिस्टेक. So you need to be aware about your own self. Awareness is very important.
Very important.
And fourth, as I said, FRA, now we come to T, thought. Thought is a very important component of being resilient. So लोग बोलते हैं ना, जैसे आप सोचोगे आप वैसे बनोगे. So rational thinking. How can I talk about this situation to others so that I get some help? How can I be more aware of this situation, and how I can change my thought so that I'm able to handle the situation better.
Right. But I just have a related question.
Sure.
That if we apply FRAT to our regular way of life, is that a way that we can make sure or ensure that we may not have a mental health situation?
No. So that will only help you to deal with the situation. But if you have a biological propensity to develop anxiety or depression, how much ever resilient you are, how much ever strong you are, and how much ever you apply these principles. See, I tell to my all patients, you can be physically fit, you can have a good diet, you can really exercise, you can have normal weight, still you can develop diabetes.
True.
So even if you have good resilience, even if you have a resilient skills, you have developed these skills and you are prone to develop a mental health issue, you will still develop anxiety and depression.
Very well explained, doctor, because recently we've had so many young, very fit people who have suddenly just, we've lost them to a massive cardiac arrest, and even doctors are puzzled because a lot of them, have been checking their fitness, but suddenly something's going. So obviously there is no, formula to ye karoge, to ye result aapko milega. And of course, we've also over the sessions that I've had with other psychiatrists, they said that it's a biological disorder. So there is nothing to it, but of course these things will help, especially reaching out, being aware. So even if you are in that situation, you probably will reach out for help earlier.
That is right.
Then
the problem happens when you delay taking help. Not only, okay, you have a mental health issue, and if you go to a psychiatrist and time, you will get recovered very fast. If you delay, you will have a lot of problem. Even if you have a financial situation, you open up about to your friend, at least he can help you or guide you where you can stop, what can you do. So reaching out is very important in any situation. What happens is we bottled up our emotions, our feelings and our problems so much because of fear of judgment. अरे लोग क्या कहेंगे, इतना होशियार बंदा, इतना अच्छा बंदा, इसको डिप्रेशन कैसे हो गया, ये फाइनेंशियल लॉस में कैसे चला गया. तो हम लोग हमारी मुश्किलें लोगों को बताते नहीं, हम छुपा के बैठते हैं और वो छुपाने से मुश्किलें बढ़ती है.
नहीं बिल्कुल. और ये जो suicidal tendencies भी होती है, so often you realize that it was the person was in this depression but was not willing to talk about it.
ये बहुत अच्छा point आपने raise किया, because people say that if you talk about suicide or discuss about suicide, you may induce that thought, which is not true. If that person has a suicidal tendency and if he opens up about it, lot of times we can save that person.
True.
So it's very important to open about your feelings and emotions to a friend, to a psychiatrist or whoever. But it's very important to reach out. Reaching out for help.
And even that is being resilient.
Yes,
isn't it?
Accepting your problem and accepting that I messed up. Okay, I take the responsibility.
But I want to fight and I want to get back to normalcy.
Taking responsibility is a very important part of resilience, and reaching out is a very important part of resilience.
Right, because sometimes we are looking at that as a negative thing. Oh, मैं अपने बलबूते में कर सकता हूँ, मुझे किसी की जरूरत नहीं है, मुझे किसी की सहारे की जरूरत नहीं है. I am a very resilient person. I've always been like this. मैं खुददार ये वो.
Yes.
And that can sometimes become your worst enemy.
So what happens is, suppose by till 35 you always won everything. You have been a first student where you have come first. You have succeeded in life. But life can sometimes throw challenges.
Of course.
And at 35, suppose you suffer from huge losses wherever it is. You don't want to take that, you can't digest that, and you then don't want to tell about it.
True.
So it's very important to reach out. Even if you have been very successful or you are very, very talented, you can still go through problems, you can still go through anxiety, depression. The idea is to reach out.
No, of course, wo fear ke. And one other thing that I've noticed, doctor, is that, this I'm saying from my own personal situation, that at the point when my wife, who was diagnosed with medical depression about 3 years now, but as she started reading more, as she started getting into meditation or getting into, and of course she had to be medically also to keep things in control, but now the way she responds or reacts to the same situation at which she would be very stressed, very angered, very annoyed, now I see that she is handling it in much more mature way. And I see the trait of resilience, like you said, has actually got better post her mental depression situation.
So lot of times people tell me and ask me question, "Ki doctor, can medication make me resilient and strong?" The answer is yes. Sometimes, because to be resilient you require certain neurotransmitters in your brain. People say, think positive or see the positive side. If you have a serotonin, norepinephrine or dopamine neurotransmitters lacking in your brain, if they are not produced adequately, you may not be able to see the positive side of any situation. So sometimes you need to give medications to patients of depression, anxiety or any psychiatric issue. And there is a lot of resistance in taking medication because people don't see this as an illness. People see this as a weakness. But let me tell you by this medium that please, if your psychiatrist prescribes you medications for your condition, do take it. If you take it regularly, you will be able to stop it also, and you will be able to come out of your depression and anxiety successfully. So taking medication is not a big problem. If you take it under a proper supervision of a doctor, no problem. And medication can make you strong and resilient, yes, if you're going through clinical anxiety and depression.
And people have tried to fight it and have decided to not, take it just to, show that I'm resilient, I can do this without this. So and that has got them
very bad situation because people say whatever I will suffer, but I will not take medication. But that should not be the case. You should be open to idea. Yes, of course, under supervision, but you must take because otherwise what happens, sometimes people take help of alcohol, take help of cannabis to deal with their emotional issues or anxiety, depression, and then you'll end up in a bigger trouble.
Bigger trouble, of course. You do more physical as well as mental harm to yourself when you do that. So doctor, very, very interesting because this is like two sides of the same coin. One can think of resilience or being resilient as being stubborn, being tough on yourself, give yourself that hard laugh. No, you can do it. But sometimes in a situation like this, in a mental health situation, if your brain is not with you, then it's giving you all the wrong answers, giving you all the wrong signals. And what you think is being resilient is actually being stubborn, being an enemy to yourself.
Yes. So actually resilience is exactly opposite to stubbornness. Resilience is actually being malleable, being open to change, being open to accept your problems and reaching out.
It's not the kind of superhero that you want to be.
You should never be a superhero. You should be a normal human being with normal things you should do in life, and then you will reach to super heights.
Of course.
As a psychiatrist, we feel so overwhelmed by the patient when they come out of their problems. It is so nice feeling, and I think that feeling keeps us young and going. So before I
go,
कुछ
मस्ती सूझ रही थी, लेकिन आपने बहुत सीरियस और बहुत
ही प्यारी बात कही।
नहीं, मुझे लगा कि ये जो बार-बार आप फ्रांस के ट्रिप्स करते रहते हो, आईफिल टावर को देखकर I think. But do you speak French?
No, I don't know French, but I write. So
poems. How do you manage when you go there? When you were in France and you spoke about mental. Of course, you spoke in English, I'm sure.
Yeah.
But I'm told the French are very.
No. I think where I went, I think it was very nice experience.
Okay.
And they were very, they were looking forward to understand about India and mental health.
Right.
So it was a very nice experience.
So did you realize that most countries are in a similar situation?
Of course. As I mentioned, stigma is global phenomena. Mental health problems are a global phenomena. So it's everywhere it's same. And I think somewhere or the other, because in India we still have these family ties and we have joint families staying. Yeah.
It could work negatively also, but
no,
mostly
it works
positively
because when you are lonely, you are in a big problem. So if you are in a family or people who have some support, it's always very helpful.
True. Yeah, I think that's how we've been able to survive. Be it financial situations, emotional situations, because there's always someone there with you, and that's very important. And so I guess then it becomes more important for us to really be there for each other.
Yeah, absolutely.
And if someone is reaching out to you in a situation like this, you have to be there for that person.
I think everybody should have a 2 a.m. friend. A 2 a.m. friend is somebody who you can go to any time and just talk about anything, and that friend is ready to accept it and acknowledge and listen to you. So I think everybody should make 2 friends who are there for you, because people make a lot of friends but they don't know whom to go to. Everybody is a friend, but you need to have that friendship.
I find it so crazy sometimes on social media. They're putting out the deepest, darkest secrets of their life and they're looking out for help. It goes to show that that there's a lot of lonely people out there who don't know who to reach out to or who to. So 2 a.m. couple of 2 a.m. friends
is very important.
Very important. And so frat is the word today.
Yes.
Wonderful, doctor. I'd just like to.
Before you end, I write poems.
You were mentioning,
I've written something which describes resilience.
Right.
So it says, कष्ट तू कितने दिन मुझे सताएगा, मेरी हिम्मत देख के तू नष्ट हो जाएगा, थोड़े दिन तू मुझे जरूर रुलाएगा, पर मुझे नहीं तोड़ पाएगा, मुश्किलों से हारना मैंने सीखा नहीं है, मेरे आगे कोई माइकल अल्टिका नहीं।
तेरे ये हुई ना बात, क्या बात। I like the end. It had a sort of एक जोश था।
Yes.
मेरे सामने कोई माइकल अल्टिका नहीं है, ये हुई ना बात। I think that's how we have to always keep ourselves
Absolutely.
हाँ?
चार्ज रखो,
हाँ, charge
बट
रखो।
कभी मुश्किल में है तो प्लीज बोलो कि हाँ हो गया,
Of course,
गलती
of
हो
course,
गई
of
भाई.
course. But वही तो चार्ज रहना है ना.
हाँ, वही charge
हाँ हाँ कि you face it, you don't run away from
Run
it.
away from
And if in a situation you have to face it by taking help, then that's also facing it only
That
ना.
also facing it.
चलिए आपने इतना अच्छा पोइट्री किया तो मेरे भी दिमाग में एक गाना आ रहा है which goes in this situation के जब लाइफ हो out of control होठों को करके गोल पिचक दुम तक 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 जब लाइफ हो out of control होठों को करके गोल सीटी बजा के बोल all is well. So yeah, sometimes by just saying it kind of helps you a little bit already.
Yes.
It puts you on the path of thinking positive and staying positive.
Yes.
So thank you, Dr. Shah, for this very, very informative session and to clear certain misconceptions that people have. And I'd also like to thank Lupin for creating this Say Yes to Life series. And well, this is not the end. We're going to keep doing this, and hopefully we meet again with a new topic with something else to talk about. आप तो मुंबई के ही हैं,
Yes,
तो
yes.
जब चाहे मिल सकते हैं.
बिल्कुल.
So thank you once again.